saying is a safe level of alcohol consumption. And certainly as we get older, it's probably better to really minimize the regular consumption of alcohol. Maybe occasionally having 1 or 2 drinks may be okay, but regular consumption may not be a good idea.
Okay, any other message you want to get out there to the public?
Stay healthy.
Absolutely. All right. Well, Dr. Vijay, thank you so much for joining us this morning. Remember, Dr. Vijay is here every Sunday to answer all of your medical questions. So if you have a question you'd like to ask us in the future, we're all ears. Shoot us an email at
probably better to really
developing breast cancer. This morning, the doctor is in to discuss a number of ways and methods to decrease our risk of developing breast cancer due to alcohol. Thank you for joining us this morning, Dr. Vijay.
Good morning.
All right. So talk to me about the correlation between alcohol and breast cancer.
Well, you know, there's many factors, of course, that go into increasing your chances of developing breast cancer, and the alcohol consumption is actually one of them. It's not a major risk factor, but it's certainly one of them. And, you know, alcohol, anything when done to excess is generally not good for you, and that's not any different with alcohol. However, the one thing that we don't know of specifically is exactly how much alcohol is true moderation. In other words, what amount of alcohol can we drink without any bad effects and with potentially the beneficial cardiac effects that we also hear about.
Okay, and talk to me about the low levels of alcohol drinking.
Low levels of alcohol, exactly. You know, if you drink much less than about 1 to 2 drinks a week, this hasn't really shown or hasn't really been correlated with increased risk of breast cancer. But once you get into drinking 1 to 2 drinks a night, and certainly if you're drinking more than 3 drinks a day, this has been shown to significantly increase the risk of breast cancer. Again, this isn't the major factor. The major factor is probably still your genetics. So if you're in that group where you have an increased risk of developing breast cancer, such that you have a family history, you know, with mothers or sisters who've had breast cancer already. If you have a personal history of breast cancer on the other side, say, then you want to be very careful about consuming alcohol.
Okay, what are other factors that can increase chances of breast cancer?
Breast cancer. You know, genetics, as I mentioned, is a huge factor. Obesity is also a factor. So if you tend to be overweight, that increases your risk of developing breast cancer. Also, the other factors are lack of physical activity. So if you become more active, actually, if we look at it from a positive standpoint, if you become more active, watch what you eat, lose your body fat, and tend to gain more muscle, that decreases your risk of breast cancer. Additionally, having more children is protective.
Okay, and how can we decrease our chances of breast cancer?
Well, by exercising, losing weight, and decreasing body fat stores, potentially breastfeeding for longer periods of time, having more children, and decreasing the amount of alcohol you consume. These are fairly simple ways where we can go about decreasing the number.
And talk to me about binge drinking. How does that affect breast cancer?
Right. So most studies and what we think about is the average amount of alcohol that you drink per night. So drinking more than 3 drinks, and certainly more than 3, or even if you drink 1 to 2 drinks a night, increases the risk. But binge drinking, when you have more than 4 to 5 drinks in one setting, has also been shown to significantly increase the risk of breast cancer. So not only is binge drinking bad for you in general, and with all the other factors that we know about, but it also, in the case of breast cancer, makes it more likely that you might develop it in the future. So another reason not to do it.
Definitely. A lot of good tips there. And remember, Dr. Vijay is here every Sunday to answer any of your medical questions. So if you have a topic you'd like us to discuss in the future, please shoot us an email at news@KIIITV.com, and in the subject line, write "Doctor is in Sunday." Thank you, Dr.